We have two wonderful staff here, Louise Simon and VP Good here, and VP is this live?
Yes, this is live on Facebook.
Okay.
I'm just focusing on.
Actually, talk to microphone. Although I prefer actually walk around. Probably the sound. This probably would be better if I talk to my mic. So today, I want to talk something that I have done a lot of research related to oral health in older adults, oral health and healthy aging. But I'm trained as a gerontologist, not a dentist, but I consider myself as also a dental researcher. So this is actually the report that we at Gerontological Society of America organized this oral health work group. That we wrote this report called Oral Health, an Essential Element of Healthy Aging. So this is 6 members in this work group, and only one that without a dental degree. So the reason that the GSA actually now it's actually really put a lot of emphasis and effort to promote oral health research among older adults. Is really think about actually geriatric dentistry and oral health in older adults. This topic area is really understudied. If you look around the country, there are not many researchers that are doing this type of research. But on the other hand, there's increasing evidence suggests that actually oral health is very important as an essential element of a general health status, which actually is the topic of my talk today. So for this report that GSA put together, this white paper that have been widely distributed at GSA membership, that in July 2017, that IAGG, International Association for Gerontology Geriatrics, as well as GSA, hosted this conference. 7,000 people attended. This actually white paper was distributed to every single attendant to the conference. But in this report, that we basically said that basically overview of oral health in older adults in the United States, and look at the linkages between oral health and the systemic diseases, as well as the challenges facing older adults that in terms of access to dental care, etc. So that's what actually we are, as a part of this working group, it's ongoing. I just got the invitation to serve as a member of this work group for this year, 2019, to promote this oral health research and education in our scientific community. So oral health and systemic diseases. So there's increasing evidence suggests that there's associations between oral health and systemic conditions that look at, for example, oral health in relationship with cardiovascular disease, diabetes, respiratory disease, stroke, osteoporosis, and depression. So several years ago, our team received a grant from NIDCR, NIH, a particular look at the social support, depressive symptoms, and oral health, and found that for these individuals with long-term chronic depressive symptoms, that the oral health status is very poor. So, tooth loss, disability, and mortality. That our team also recently published a paper look at tooth loss in relationship with onset of disability. So we use longitudinal data, health and retirement study, and the 10 years data, and found that the number of tooth loss that is strongly and independently associated with onset of disability, that measured by ADL and IADL. know that more than 10 years ago, then Paul Holm Patterson, their group, used the data from Europe and found that tooth loss actually is strongly associated with mortality in older adults. So basically, think about this, that we speculate that tooth loss may be an early indicator of accelerated aging. But direction of causality is unclear, because all we have used is basically using this observational study, epidemiological, large epi studies. So there's no clinical trial or anything else. So the causality is still unclear. So you look at cognitive function and oral health, that our team is very much focused in this area, that in terms of oral health in relationship with cognitive function. Cognitive impairment, as we all know, that is a very common problem among older adults. Based on my colleagues, Brenda Plasman's, their research using national data in the United States, they found that for those individuals 71 years and above, actually 1/3 of the population that has some level of cognitive impairment. So including mild cognitive impairment and the dementia. So that's why cognitive impairment is very common in older adults. So how this in relationship with oral health? So start from actually more than 10 years ago that I worked with Brenda Plasman and a group of other people from Duke and University of Michigan, that we used the National Health and Nutrition Examination Study, national data, look at actually across the spectrum for those individuals aged 60 and above, found that for those individuals have a low cognitive function. So I'm not saying any kind of using the term cognitive impairment. Just look at actually some screening measures. Look at for those have low cognitive function for those individuals aged 60 and above. Is associated with a higher number of tooth loss and a higher prevalence of periodontitis. So basically, actually, it's almost a linear relationship. The higher individual's cognitive function, the better their oral health is. Then you're controlling for other important covariates. This is a cognitive function was strongly and independently associated with tooth loss and also with periodontitis. So this paper that was published at the Journal of Gerontology and Medical Sciences. Then we continue looking into this and look at actually, so later on I received NIH grant, and we were able to, because NHS we were not able to look at this and make diagnosis of individuals at what stages of individual, whether they're cognitive impairment, whether they actually have a mild dementia or moderate dementia. So after we received the funding from NIH, we actually did a study in West Virginia. At that point, I was at West Virginia University. We look at actually make a diagnosis using very sophisticated cognitive assessment. Look at actually for individuals with different levels of cognitive function. That we found that for compared to individuals with normal cognition, individuals with mild cognitive impairment actually have a higher number of decayed teeth, increased PAC index in gingival inflammation, which actually means oral hygiene. These are the measures for oral hygiene, PAC index and gingival inflammation, in poor oral hygiene practice. So we published 2 papers in this area and look at actually, also they have a poor self-reported oral health status for those that, so MCI, those individuals with mild cognitive impairment, that compared to those with normal cognition. So then actually we also look at actually cognitive function and the dental care utilization using National Health and Nutrition Examination survey. That we found actually interesting when you look at the level of cognitive function, that was associated with dental care utilization as well for those individuals at age 60 and above. So again, this is using the cross spectrum of the population. We found again interesting, it's almost a linear association. The higher individual's level of cognitive function, the more actually likely they use kind of regular dental checkup. So this is also kind of interesting to look at how actually cognitive function in relationship with dental care utilization, regular dental checkup. So then actually in 2016 we did a systematic review, look at oral health and the cognitive and the function, and the particular using actually, of course, this is a global search. Look at all the literature published around the globe, and see actually what exactly the relationship between these bidirectional relationship. So particularly, actually, this systematic review was focused on a longitudinal study. So we found that actually the findings on the relationship between oral health and the cognitive function are inconclusive at that point, because many studies found that there's a relationship. When you either you look at cognitive function as a study outcome, or use oral health as study outcomes. So there's find this kind of relationship, but some studies didn't find that the relationship was significant. But on the other hand, that we think that this field is very promising in there. So when you look at these studies, that we found that dental problems actually may be particularly attributed to the behavior characteristics associated with cognitive decline and the dementia. For example, self-neglect, when those individuals have a certain level of cognitive impairment. So these kind of oral hygiene practice, actually, if you really kind of think about, this actually can be avoided with in-home dental care and the dental visits. So this systematic review and many of our using kind of large epidemiological study results was the foundation for us to build a case for us to actually start working on a clinical trial. That's actually, we had a pilot study, and now we just this a clinical trial just got funded for year 1 to look at how we actually can improve individuals' oral health, that working with their family members to improve their oral hygiene. So at the end, of course, ultimately to improve oral health for persons with mild cognitive impairment and mild dementia. So these are based on many of our kind of preliminary results for this ongoing study year 1 clinical trial. So then we actually now moving forward that I'm particularly intrigued about this kind of relationship. So we actually have just completed the study, and this manuscript is currently under review. Is look at use 5 waves of the health and retirement study.